Hi, welcome to What's Happening at Tri-City Medical Center. I am Kellie Davis, and I will be your host for this series made in collaboration with KOCT, North County's channel, and Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local hospital and to provide you with information for a healthy lifestyle. With us is Dr. Penvose-Yi, a board-certified OB-GYN affiliated with Tri-City Medical Center. Her experience spans both coasts and the Midwest. She relocated to San Diego to create her vision of a women's wellness center that values the patient as a whole. Her office services women throughout their life. She is here today to talk about women's health after menopause. Welcome, Dr. Penvose-Yi.
Thank you very much. Nice to be here.
Well, the first question is to ask, what is menopause? But I know from my grandmother's day, just kind of that they used to talk about going through the change. Is this the same thing we're talking about?
It is the same thing. There's a lot of definitions you can use, but the change is the perimenopause and then menopause and that transition that happens from the start of symptoms to the last period to hopefully, in most cases, the symptoms going away, but not in all cases.
So there's this this idea, or I don't know if I want to say wives' tale, I don't even know if that's politically correct to say that anymore, that back in the day they sort of attributed menopause with the change and going crazy.
Right, the hysteria that's associated with it.
Why was that?
Well, you know, menopause, part of menopause is you do, with your hormonal change, you can get emotional change. Sleep deprivation is one of those things, and sometimes it's just because we're getting up to go to the bathroom a million times a night. That's a new symptom that as our vaginal tissue dries up, that can happen too. Now, of course, you know, a lot of the famous doctors out there talk about the wisdom of menopause. Some of us kind of figure out what's important and what's not important too. So there's definitely pros and cons to it, but I agree with the wisdom of menopause, but we definitely have some things that we can help women to transition through it a little bit nicer.
Because in essence, with menopause, because we're talking about hormones and all of these things centered around this menopause, this change that you go through, that's chemical.
It's chemical,
stuff,
and our body is just a big machine, you know, that chemicals take care of managing. So when those chemicals change, it changes a lot of things in our body, you know, mind, physical, emotional, all sorts of things.
So you said, we talked about menopause, so what is this perimenopause?
So perimenopause is usually the years leading up to menopause. I always tell people the average age of menopause is approximately 51, 52. The perimenopause is the time around menopause, commonly up to 5 years before our actual last period happens. We might start having some of the symptoms that we attribute to menopause. We might have the hot flashes, the night sweats. We might have the associated mood swings. We might find that our bladder is a little more irritable. We might get up more often at nighttime to go to the bathroom. Pain with intercourse, drier vaginal tissues. All of those things can be associated with menopause.
And is it true, because this is something else I heard, and we hear this is why I'm so happy to have you on the show, doctor, because you hear all these things that go on with women and women issue. Is it true that if a woman has had a hysterectomy earlier on in her life for whatever medical reason, you know, whether she's in her 30s or even 20s, can they go through this menopause earlier than?
So they can. So, you know, part of the blood supply to our ovaries comes through the uterus. So hysterectomy or even tying your tubes can cause your menopause to happen a little bit earlier. It's shown to happen. So a year or two earlier, when we give women a hysterectomy, that's what we usually tell them. You might get your menopause a year or two earlier than you were going to get it.
So some of the symptoms that you talked about was, you know, the hot flashes. That's what seems to be quite simple. They show it in all the movies. It's the time.
Right. I had it this morning. So yeah, the whoo, you know, and you're just sitting there, and out of the blue, the heat comes and hits you. So that, and there's a lot of women who can relate to that.
How would you know? I guess it's simply that you'd have to go to a healthcare professional like yourself.
How do you know it's a hot flash for sure?
That you're going through this thing,
right?
This change.
So you want to talk about it with your doctors. You want to talk to them about all the symptoms you're having. Of course, you can Google it and look online, but it's nice to have someone to talk to and see like, boy, do you think that this is part of it? I mean, we can have the menstrual irregularity, but some women don't get that. Some women have their periods right up to their last period, but they also have hot flashes and night sweats and all those things happening on the way to that last period.
Okay. So besides menstrual cycle changes, what are some of those other signs?
And we've kind of alluded to them.
Yeah.
The hot flashes, the night sweats, or just getting warmer. You might notice that, okay, I used to be able to wear this, but now I can't wear this anymore because I get hot when I'm wearing it. You might notice that you're more uncomfortable down below, a little itchy, or when you have intercourse, it's drier, it's more painful. Some people almost stop having intercourse altogether because of the vaginal dryness symptoms. You know, the hysteria, our mood changes. We're tired, sometimes we're getting up more at night to go to the bathroom. Just the hormones alone can change our moods, and kind of, we can look at it as clarity or we can look at it as hysteria. I'm going for clarity.
Okay. And do these symptoms continue after menopause? And I guess more importantly, when does it end, and when do we know that it ends, maybe?
So I like to counsel my patient, menopause is your last period. Postmenopause is 12 months after your last period. So if you've gone a full 12 months without a period, you are officially menopausal. It is not normal to bleed past that point. You need to see a doctor if you are bleeding 12 months past your last period. That is one thing that's really important to know for cancer prevention. But some women may have symptoms leading up to menopause, and they have last period, they feel better, or those symptoms may carry on past that last period. Unfortunately, for some of us, those symptoms can last a lifetime almost. Diet and exercise are definitely an important first-line therapy to optimize your healthy diet and exercise regimen. But then we talk about all the treatments like hormonal treatments, non-hormonal treatments to deal with the hot flash, the night sweats, decreased sex drive. There's topical hormone therapies for vaginal dryness. We now have new laser therapy for vaginal dryness for those women who can't have the hormones, or the hormones don't work for them, or they can't afford the hormones. Trying to think what else we talked about.
Well, along these same lines, I'm a former athlete, and I remember when I was younger, some of the distance runners, for example, they wouldn't get their periods. Obviously, they're not in danger.
They had such a lean body mass. Exactly.
And as a woman, I find when you talk to other women, we have our cycles change, and we're not sure what this is or what that is.
Right.
How is it just you have to get a good healthcare professional? I mean, how do you know when you're really, and so
we're going to have menstrual changes around menopause. When do we need to worry about them? We need to worry about them if our periods are coming more frequently. So if every month we're having 2 periods, we need to worry. If we skip a period here and there, and we know we're in our mid to late 40s and we're around that time, an occasional skip period, and we know we're not pregnant, that's okay. But if we're having frequent periods, or if we're spotting all the time, bleeding after intercourse, those are reasons to see your healthcare provider before your routine well-woman exam.
We have about a minute, I believe. Vaginal atrophy.
Right.
What is that?
So vaginal atrophy is when our vaginal tissue, whether it's postpartum, breastfeeding, birth control pill, postmenopausal, loses its vaginal estrogen, it loses its hydration, it loses its elasticity. That can cause bladder symptoms, that can cause pain with intercourse, that can just cause general irritation.
Okay.
And so in the past, we've had traditional treatments are vaginal estrogen and over-the-counter lubricants, which work for some people, but not for all people. I was really excited to find that there's a new laser treatment out called the MonaLisa Touch Vaginal Laser. I got very excited. I describe myself as a bread and butter OB-GYN. I don't usually get excited by all this fancy stuff, but when they came to me with this, I got very excited because there's a lot of women out there who either don't respond to the vaginal estrogens, don't tolerate the vaginal estrogens, can't have the vaginal estrogens. So now we're lucky enough to have the MonaLisa Touch, and it is good for your bladder, it's good for your sex life, it's good for the vaginal dryness and your overall vaginal health. And we want to stay on top of our vaginal health. We want to talk to our doctors about it every year when we go see them. We want to keep that tissue healthy and not let it get into such a state of disrepair that it's hard to reverse the changes that have happened.
Well, we're going to talk more about that in a moment, and we'll be right back.
Tri-City Medical Center, a leader in advanced healthcare close to home.
When I first came to San Diego and needed a doctor, I found Dr. Ferber.
That was 30 years ago, and since that day, Dr. Ferber has cared for Kathy's family. Over time, they have dealt with some stressful medical concerns.
I don't know how we'd have gotten through our healthcare issues if it weren't for Dr. Ferber and Tri-City Medical Center.
What I love most about my practice is that we become family.
Dr. Ferber just really cares.
Tri-City Medical Center, advanced healthcare for you.
Hi, welcome to What's Happening at Tri-City Medical Center. With us is Dr. Penvose-Yi, a board-certified OB-GYN affiliated with Tri-City Medical Center. Her experience spans both coasts and the Midwest. She is here today to talk about women's health after menopause and managing symptoms. Well, welcome, doctor.
Thank you.
Why is it so hard, or why do women still feel something about talking about their vaginas, and even saying the word vagina,
Right.
it's not a four-letter word even.
Right.
What's that about?
Well, I definitely think there's a generation that just definitely did not talk about it at all. And then nowadays, I just don't know if it's, well, first of all, it's a health issue too. So, and not everybody does a good job taking care of ourselves. We kind of put ourselves, especially women, we put ourselves as last in healthcare. We take care of our kids, we take care of our husband, we take care of the pets in the house, we take care of our job, but we don't even think to take care of ourselves. And so, and then when you talk to people about it, they don't know a lot about it. So either they'll kind of say, well, yeah, that's just the way it is and it's not really that important. Or, you know, I don't really know anything about it, and then it just gets awkward and nobody wants to talk about it. We joke in our office all the time that we love vaginas. So come to Radiance, we want to make sure your whole body's healthy from head to toe, including your vagina.
Yeah, and talking about your vagina and some of the things that accompanied it like discharges
Yes,
and things,
yes.
and I hear these horror stories, for example, and not just with menopause, but that there's some changes that happens to our bodies
Yes.
that we see even
Right.
with the discharge, and they're
Right.
so afraid to.
Right, and who wants to go to an OB-GYN, right? I mean, the joke is, who do you like to see less, your dentist or your OB-GYN doctor, right? So how bad is it that you're going to come and see me about it if it's just not your well exam, right? That's the question. And you know, one of the things with menopausal discharge, it's a discharge because there's an absence of normal healthy tissue there. And a lot of older women will come and think that there's something really wrong with them, that they have an infection. And we really just have to do a lot of teaching that it's not an infection, it's just that the tissues are aging and we need to treat them so they go back to a healthy discharge.
Okay, and can vaginal moisturizers or lubricants, speaking of that, help with that?
Absolutely, they can. So there's two typical treatments that we've used for vaginal dryness and getting the flora. It's bacteria, you know, from our mouth down through the out part there, and anything that's the outside of our body, which can even be the inside of our body, has a normal bacteria, normal yeast, and normal flora that lives there, and it has to stay in balance. And as we age, that balance gets lost. And so we can do vaginal estrogens because, of course, when we've been breastfeeding or postpartum or menopausal, we lose that estrogen, and the estrogen is a big, important part of all of our skin, including the tissue in the vagina. And that estrogen helps to bring back elasticity and hydration in the area. For most women, it works, but not for all women. Also, there's over-the-counter lubricants that you can use, the types you have with intercourse, and then there's now vaginal prebiotics and vaginal biotics that we can put in. And again, that helps get the flora back in order, helps get our pH back in order, and hopefully make that a nicer environment. And then finally, a newer treatment, because those treatments aren't always successful, is the vaginal laser to help rejuvenate the tissue in the vagina, to use our own body's natural healing mechanisms to heal that tissue and make it healthy and younger again.
And I know that, well, at least I heard, again, all of this thing, we hear all these things about your vagina and
Yeah.
healthcare, and you start Googling things, but I hear
Yes.
things like taking, was it, they find this in yogurt, I don't know if it's lactobacillus.
Right, so the
or
prebiotics or the vaginal probiotics, yes.
Do you find this helpful for women who are peri or menopausal?
So generally, healthy diet is important, but it's been my experience that eating the yogurt isn't going to fix it. I've even heard of people putting yogurt inside.
I've heard of that too.
Yep. So it's not common. But now they sell nice over-the-counter products that have the prebiotics or the probiotics in there, and that they can be inserted vaginally as a like a gel. And those can be very helpful in some cases. So you always want to do the minimal amount you need to get the greatest success in recovery or rejuvenation for a patient. So for some people, that's all they need. They have the tissues overall, it's held up pretty well for them, and they just need something to maintain it.
And when we speak about vaginal dryness, obviously a woman who is married and has sexual intercourse, it's probably pretty clear that they're not as lubricated as they once were.
Absolutely, and this can seriously affect our relationships. When we're not able to have comfortable intercourse with our partners, that's a big deal. And we're not even always comfortable talking about with our partners, or if our partners know that we're uncomfortable with intercourse, then they feel bad, and that changes the dynamic of the relationship. And if they don't know what to do or don't know where to go, it can cause problems that shouldn't even have to happen.
And the symptoms of vaginal dryness seems to be very clear, but if you're a woman who happens to be celibate and not married,
absolutely.
how would you know that you are, I don't know, suffering from vaginal dryness?
Absolutely. So we can have where our bladder becomes more irritated. You have more often you have bladder infections, or you go to the bathroom more often. Now there's other things that can contribute to those issues as well, but dry vaginal tissue is one of them. If you think about it, our bladder lives above our vagina, lives above our rectum. So if the tissue in here is not healthy and it's dry, the bladder that lives above it gets irritated. And if we don't have that healthy flora down there, the bacteria that live around the opening to the entrance to the bladder the bad bacteria can overgrow and get into the bladder and cause a bladder infection.
Is it, I don't know if the word is safe to say, but if you are going through, if you're having bladder infections, can that be, so you're saying that could
absolutely.
be?
One of the indications for the vaginal laser that we have at our office, the MonaLisa Touch, is that it can decrease the frequency of bladder infections for some people, and I've seen really nice success in that area.
Okay. And what are bioidentical hormones?
So I'm an ex-chemist, so I think that, I think that hormones are hormones. So there's bioidentical just means it's from more natural sources like plants. They do the same things as hormones that we derive from a more chemical means or isolation from other sources. But some people feel that they're more natural, and I do believe that. There's these receptors we have where the estrogen comes in and hits the receptor, and maybe the bioidentical ones just fit a little bit more and make some people a little more comfortable. So I work with both prescriptive and bioidentical hormones, and indeed some hormones are prescriptive and bioidentical, but they're more natural hormones that people use.
So less chemically involved.
Yes.
But is that still, you still take it like in a form of a pill? How do you administer
most
that?
of the bioidenticals are topical creams or gels. There's one that's a spray. There are pellets that they make. There's some, I don't do the pellets, but some people will do the pellets or little injected pellets that have a delayed release of that hormone.
Okay, and is there a way to prevent menopause symptoms?
Well, there is, and this is a tough one, and everybody deals with this, but healthy diet and exercise is the first line treatment. Of course, none of us want to hear that, including myself. But the healthier, the more natural and healthier our food is, and the more we exercise, and it doesn't have to be really intense exercise, it just has to be regular walking, some regular athletic activity, and in keeping ourselves at a healthy body weight. That will help with the decreasing the menopausal symptoms of the hot flashes, the night sweats, the sex drive, and all of those things. That's the first line treatment.
Okay. Well, thank you, doctor. And if you want further information on women's health at Tri-City Medical Center, please visit tricitymed.org.
Tri-City Medical Center, a leader in advanced healthcare close to home.
By 2007, I'd completed 8 Ironman races, but a ruptured herniated disc caused me debilitating pain.
Kathleen McCartney, winner of the 1982 Ironman Triathlon World Championship, has conquered the event considered to be the most grueling single-day sporting competition in the world.
I performed a microdiscectomy on Kathleen. Her surgery was a success, and she returned to feeling pain-free.
I was feeling good, but I stopped running. I didn't want to risk reliving all the pain I'd just been through.
Over time, that changed, and her focus turned to competing again.
I needed to rediscover my strength, With Dr. Lean's support, I started to train again for the event that I won 30 years earlier.
I worked with Kathleen to help her strengthen her core and make sure she remained injury-free. She turned her adversity into triumph.
Thank you, Tri-City Medical Center, for giving me my life back and for the incredible orthopedic work that you do.
Tri-City Medical Center, advanced healthcare for you.
Hello and welcome to What's Happening at Tri-City Medical Center. With us is Dr. Penvose-Yi, a board-certified OB-GYN affiliated with Tri-City Medical Center. She is here today to talk about women's health after menopause and the MonaLisa Touch treatment. Welcome, Dr. Penvose-Yi. I like saying your name.
Thank you.
This is very nice.
Nice being here.
So the MonaLisa vaginal laser.
Right.
What is that?
So just like we laser our face to get the tissue healthy and elastic again, it's actually a laser that goes in your vagina and the outside of the opening to the vagina that gets that tissue healthy again and gets it elastic and gets the hydration back to it and the.
I'm looking this way because whenever I hear laser, you hear about laser this, laser that, and I'm like, do I want a laser? Because you're going to go inside there.
Right.
You know?
We like to think of it as light energy in the vaginal tissue that it's kind of like a small local irritation that causes our body to say, hey, what's going on there? And then it sends all of our helpers in to re-stimulate natural, healthy tissue growth.
So this laser treatment stimulates your
fibrin and your elastin to regrow in that area. So before, when the tissue is dry and unhealthy and low estrogen, that type of healthy tissue just slowly dissipates and isn't there as much anymore. So the tissue's dry, it doesn't stretch, it tears easily. It's not healthy. So just like, as we age and our face loses that elasticity and things seem a little saggy, and that's the other thing the laser can do for tissue that's gotten stiff and non-flexible, it can give that elastic back to make things more malleable and more comfortable, for example, with intercourse. Same with our face. We want it to be tighter and lift. We want that vaginal tissue to be responsive like that too.
So not only will it help with the discomfort that may come from vaginal dryness, it also will help, are you saying to tighten the area?
Yeah, so it's interesting, right? So we say it makes it more comfortable to have intercourse in that it makes the tissue more elastic and accepting, but at the same time, some people actually have gotten tighter from the tissue drying out, and so that makes it. So it can be tighter, we have a lot of babies, it gets a little looser, it can tighten it up that way. And at the same time, it can also make it more elastic so it can open up as well.
Who can qualify for this treatment, or is there people who don't qualify for this treatment?
So really, the only people who can't have the treatment are people who've had precancerous changes in that area. Not abnormal pap smears. Some people think a history of abnormal pap smear is a reason you can't have it. If you didn't actually have cervical cancer and certain kinds of treatments, such as radiation treatment in an area. But if somebody has vulvar neoplasia or vulvar type cancers or precancers, those are people who are not candidates for it. But it doesn't actually treat right on the cervix, it treats the vaginal tissue. You can have this if you've had a hysterectomy or not had a hysterectomy. You can't have it if you've had vaginal or pelvic radiation for any reason. So if you've had certain types of cancers that you've had pelvic radiation for, you can't have it. But in short, most people can have this treatment. Most people are candidates for this treatment.
And how I have never heard of this treatment myself. How does one come to know about this? Do they go to for a woman who's like, I don't know what's going on, I feel like something's going on, do they get referrals from their primary care provider at Tri-City and they're recommended, or
they absolutely can. Some people can search the net. There's a MonaLisa Touch website. You can check and see all the providers in your area. I get a lot of referrals from primary care doctors. I like to go out in the community and do educational seminars on menopause in general and vaginal atrophy and just give a woman a chance to talk about it. I do, for example, breast cancer survivors, it's a big problem for them. A lot of the medications they take are anti-estrogens. So they may be very young with breast cancer and then their body in certain areas, like their vaginal tissue, becomes menopausal-like. And so I'm starting to try to reach out to all those groups to make it a known thing. It's definitely becoming more common. When I first heard about it, I was super excited because I'd never seen anything like this. And it's such a great idea because it's an area in medicine that I wasn't always able to fix. I wasn't always able to fix the tissues with vaginal estrogen or over-the-counter lubricants, or some women couldn't have the vaginal estrogen, or even if they technically were cleared to have the estrogen from their cancer doctor because they had breast cancer or ovarian cancer, they were afraid to do it, and they just really didn't want to run that risk at all. And so now I have a treatment option for all these women that we didn't think we had an option for in the past.
And what's the recovery time for something?
That's the other really cool thing about it. The treatment itself doesn't hurt. You don't need any numbing medication or anything in the vagina. So you just feel a vibration. And I am menopausal and I have had it done. So I am truly speaking from experience. Yeah, just little vibration, and it's just a few minutes, and it just treats the tissue circumferentially. And the external part, we put a numbing, we call it a BLT, topical benzocaine, lidocaine, tetracaine, but a BLT ointment on the outside. It sits there for 15 minutes before the treatment. And that's for the vaginal opening, and then the tissues on the outside, because that's a big area of pain with intercourse. And then we wipe that off after 15 minutes. People do not feel a thing. If for some reason there's a little breakthrough area, I always say like a little rubber band snap. In one, it's like a quick second, and I felt that. So, but it's pretty rare for them to even feel that. If they just get an internal treatment, 24 hours later, they can have intercourse if they want to. If you get an internal and external treatment, 1 week later, you can try intercourse if you want again. And again, like we've said in the past, intercourse isn't the prime goal for this. Some people will experience a relief of bladder symptoms within a week of the first treatment.
So you're saying by doing this MonaLisa Laser Therapy, it can also help to your
bladder. Yeah, so people, when I was newer to the treatment, and we knew it could help with bladder symptoms, but we were initially more focused on pain with intercourse when we were newly advertising it and learning about it. But what we found is almost everybody was coming in and saying, I don't get up to go to the bathroom at night anymore. Like, huge, it's huge. I sleep through the night, including myself. I was up 2 times a night before the treatment. And then now I sleep through the night. It's great.
Now, do you have to, or maybe every body is literally different, do you have to keep going back to keep getting rejuvenated?
Right. So the standard treatment is 3 treatments, 6 weeks apart. I have found for women who have more of a problem because it's been a long time since they've had treatment for this issue, I have done a 4th treatment for them. And some of the external treatments require up to 5 treatments. But after that initial treatment,
the first one,
the first 3 treatments or 4 treatments, then you just come back once a year for a maintenance treatment to keep the tissue. And I'm finding as I'm starting to have the women come back at the 1-year visit, they're just starting to know some of their symptom return maybe a month before the visit, and then they're getting the treatment, and it's holding them for that year.
Okay, and so the procedure isn't painful.
Correct.
And you can return to normal activities.
Literally, if you want, we have to do ice. If we do an external treatment, we do ice for about 10 to 15 minutes after the treatment. And then you could go back to work if you wanted to. I personally say that's always a good reason to take the afternoon off, to have a little something for yourself. Go home, watch a movie, have some time to yourself. But really, if you had something to do, you could. A good story for our office is 2 of us had it in the office, including myself, one day, and we ended up taking a walk, and it was a New Year's Day. For some reason, I don't know how we ended up doing this, but we ended up walking from Carlsbad all the way down to the Oceanside Pier, and it rained. Not supposed to get wet after, but it happened, and I did fine. So, but we joke, you can go walk, I don't know how many miles you think that is, I don't know.
Well, thank you so much for joining us, but before we go, where can they find you in this MonaLisa Laser Therapy?
So I'm with Radiance OB-GYN, and we are literally within walking distance of Tri-City Medical Center.
Dr. Penvose-Yi, thank you. And if you want further information on women's health at Tri-City Medical Center, please visit tricitymed.org.